Hi guys, I'm so sorry. It's my first time navigating through the live. So, hi
Yeah.
Dr. Deeksha. I'm so
Hi, Mansi.
sorry. I feel,
It's
yeah, the
okay. I
network is
understand.
not
Network.
stable.
Yeah. Same here. Yeah.
Yeah.
So how's you?
Yeah, I am great. You tell me, you had a very long day.
Yeah. I just got tired.
Okay. So, for everybody, I would like to introduce Dr. Deeksha Singh for us, the founder of Hormonal Wings. We had a chat before, and she is one of the most interesting people I've come across. Very influential. It's amazing for people like us to attend lives with her. It's going to be fun. We are going to learn a lot for sure.
So can we start, Mansi?
Yes, yes, please do.
Yeah. So पहले start करने से पहले I just want you people to know कि like what is exactly the pelvis, your pelvic floor muscle, the PFM. I always used to write about the articles PFM, and now the juniors you used to ask me, ma'am, what is this PFM? Now this is the most untrusted and hidden muscle, the silent muscle we can say because it is in our body, but we are like it's invisible muscle. So it's an invisible part in the human body. So I'll start with this. Use Jerry. So I'll start with this. So this is like you can see in a human body, we have this pelvis in the central part of the body, and from here you can just easily see how deep and like instability too. It is important because from second sacral we are having our COG, and from this we have our base of support due to which we are not falling. So now again started with the pelvis. So this is like pelvis model. Is it visible now? Clearly?
Yeah, it's visible.
Yeah. So we have like two innominate bone like these, two iliac crest, two innominate sits bone is there on which we sit, and actually we are not sitting nowadays. We are sitting like this or this. That's why we are having too tight or too loose muscle nowadays because our wrong posture, because are opting for mobile phones and like reading in a bad manner. So that's why we are not sitting on a two sits bone nowadays. These are two sits bone. And in front, you can see in anterior, we have symphysis posterior, pubic symphysis is there. Then from here, running from back to posterior, we have sacrum to coccyx, your tailbone is there. They are like artes here. And two sacroiliac joint is there. And now again, we have, this is your pelvis in central part of the body. Now how this cavity, this space, this is filled by the hammock-shaped muscle, which is called as your PFM, pelvic floor, whatever you call hidden muscle or untrusted or like invisible muscle, we know. And this whole topic and even though this whole idea of today is about this muscle only, this part of the human body. For basically, it's not for women, men, even the men, women, and transgender. Whatever like short of you are, if you are a human, you got your pelvis, you got your pelvic floor muscle. Either it's for childbirth, it's for like you have penis in that part, or you have nothing, you are the mixed person. Still you got all these things, and you, if you have pelvis, that means you have pelvic floor, that means you're suffering from pelvic health disorders because our sedentary lifestyle nowadays we are having. So this cavity, this is filled by that pelvic floor muscle. But before starting, I just want you to know like this is like your there is false pelvis is there. That means there's three portion of pelvis. First is true, your mid and false pelvis. False pelvis something which is looks like a cavity, but there's no have to, we don't have to deal with the ops part. We don't have to deal with the childbirth part. But for the true pelvis, here from here the baby is going to come out to the world. So this is your true pelvis, and this mid part, this is your mid pelvis is there. So now again we'll start with the your muscle part. So I hope audience will be out. So this is this hammock-shaped muscle. This muscle, basically this hammock-shaped, diamond-shaped muscle. This is your pelvic floor muscle. From your pelvis to your tailbone, it is like from anterior to posterior. You can see, and it is basically divided in like three major layers. Your first layer, as it is visible, it consists of basically labia majora, minora, and your vulva part, that is, or you can say that have clitoris, your vaginal opening, your urethral opening, and your anal opening with external anal sphincter is there. and have STP muscle, and the external part have your this ischiocavernous bulbospongius muscle, and in back this have your levator ani. This is the full structure, and the deep part you have in the tuber in there. You can see from the inside part, that is endopelvic fascia will be there. You have your that elevator ani in all part. So and I think it is visible that it is coccygeus. This is your
Yeah.
coccygeus muscle. So basically these are like your compact muscle, which what are the function of these muscle? Basically due to these muscles we are running, like we are walking straight because of these muscles, because these are the inner core 4 muscle, because the pelvic floor transverse abdomen is in front, in the back we have multifidus, and the upper we have diaphragm. So these 4 muscle is form like a box part in the body, that is inner core, which due to which we are like going upright, we are sitting upright, we are sitting, we are lying without any pain, without any concern to our system. So due to this part only, and pelvic floor is indeed a great important part in this system. So now you can see how important it is. So it work as a, what is its function? It help in your support. Due to this muscle, our organ, that is your uterus, your in front we have that bladder, and in back we have your rectum part. It is not falling because of this part, because of this muscle, and this muscle have vaginal opening. That's why it is also help in your sexual activity, your sexual part. It also important as a person too, you need it. And in the third portion, that is more important, you have it for support. Because of this muscle, these organs are at their places, and you are having your main bladder, that's you can pass the urine through these muscle. Because of these muscle we are not leaking, we are continent. Whenever we can move confidently, we can walk everywhere around the world from our house because of these muscles.
Right.
And these muscles also help in the because of the inner core part, these muscles also help with your basic part, that is your stability, your posture. And now fifth part, because of number of these are skeletal muscle, so you can train them. Actually, you can train them. You can retrain them whenever they are having any kind of disorder. You can again retrain them.
Right.
They have that bladder in anterior, your this uterus, then again rectum in the back. So this is like the muscle have these organs settled, and the uterus you can see in this way. It is on the bladder. So when
Yeah.
a woman is getting pregnant, that means that it is going to get in this shape. It is going to be like it is going to be in this, and it is going to be like this, and it have your basic part, that is your endometrial lining will be there, and I think it is more visible than this. So we have,
Yeah.
you can see like it is basically your proper system will be there, your reproductive system, your tract you can say, which is we have uterus, three lining, your perimetrium, myometrium, and endometrium will be there. As you can see the supplies, how much it is supplied, and the ovaries by ovarian ligament, your fallopian tube is there, infundibulum is there, and it is like how much the process is going inside a woman body. You can now understand, how now relate. This is just the basic we are talking about. And now we have, this is inlet, outlet, cervix is there, then it is the vaginal opening called. Vaginal like canal is there, and this vaginal canal is open to a vaginal opening in this muscle, and on just below, just in parallel line with the your urethral opening. So we have this here, and from, you can just imagine now, from this tiny hole our whole baby is going to come out to this world, and again this muscle
Right.
will going to reshape again in that system. And if she is like having any problem, that's why we as a pelvic health physiotherapists are indeed important in their system, and that's why it's growing, and that's why it's needed.
Yeah. Yeah.
So this is like the basic part there. Now we
Yeah.
can start. Yes,
Yeah.
and thank you for
Yeah.
giving me this
Yeah.
basic
No,
intro time.
no, thank you for giving us also, because it's an interesting perspective, you know. We have to understand that everybody looks at their own field very differently. For, you know, the way you are, you love explaining the basics, and I think that's amazing because we have a variety of audience. who would be interested in every aspect. So let's start with the most common topic. Pelvic health is such a wide topic. So let's
Yeah.
discuss something like we were speaking about like assumptions. What are those general assumptions and myths we see people talking about, even in our own work community as well as outside. People have these assumptions कि pelvic physical therapy सिर्फ इसलिए सिर्फ incontinence में देना है, सिर्फ Kegels है pelvic physical therapy. उसके आगे भी काफी ज्यादा होता है. So we need you
Yeah.
to shed us light on that.
Okay, so before starting, दो चीजें बताना है. I would like to tell you two things. First thing, MPT in obsgynic and pelvic health physiotherapy are two
Right,
different topics.
right,
These are two different topics. Huh? As a obsgynic therapist, you are having some light, some introduction about it. But as a pelvic health therapist, you are like, yes, you are inside a woman body only, but you are doing a different work. You are just respected. You are always think about this muscle only as a pelvic health
yeah,
physio. But
right,
as a ops gynic, because I work some years as a ops gynic and as an amput in ops gynic, I work as an ops gynic in antenatal, postnatal, and then
right,
afterward I just go for this part. And you know what I come to know, like if we seek on some courses in near future, because it's not yet developed, like we have both courses on the same platform, because in the
hmm,
master's specialization as an elective you got some basic outline about the pelvic health, but the as our syllabus as in our syllabus in India, it is indeed like traditional for the ops kind, because I
yes,
did it and it's
yeah,
like, yeah, we need to update it actually,
yeah, right,
because most of things are like about surgery only, because we are not going for any surgery with the patient.
hmm,
We want more about to know about the muscle. We want to know about the
okay,
hormones, because as in doctor, as in physio, as in pelvic health, whatever physio, if you're dealing with a woman, you should
hmm,
know the hormones, because without hormones you're
right,
nothing. You're waste.
right. Yeah, right. So, Dr. Deeksha, you're also the founder of Hormonal Wings. So, tell
Yeah.
me, why did you feel like hormones and Hormonal Wings should be the brand that you create? How did what impacted you in your career that led you to think that hormones and Hormonal Wings should be the branding that I represent?
Okay, so in year when after last 8 year back when I started this, I was like I'm just thinking about like creating like the website. I was thinking about what should be the name. So at that time,
Yeah.
I was like thinking about the Powerpuff, something like Powerpuff, something like the Wings, like something which should be like power should be there,
Hmm.
something which is should be immortal in words.
Hmm.
So at that time, I just want to put my brand name to be Powerpuff Women's or Powerpuff Girls, but you know,
Right.
luckily they all are taken. Luckily, I didn't take them. They all are taken in the website format. So
Yeah.
I was like, nothing left. I can't do anything. यार बताओ नाम भी नहीं मिल रहा है. बताओ अभी तो अपनी
हाँ.
choice का नाम नहीं मिल रहा है. Business कैसे run होगा? So at that time, one of my very good friend and soon going to be my like fiance, he just suggested me, why are you not going for hormonal wings? You are always talk about hormones. You always write about hormones. He didn't
Yeah.
call the wings. He called hormones. So I think, and I was having wings in my mind. So we just connected it and it's become the hormonal wings. And at that time, we didn't think about that much. It is going to be that great. It
Right.
is going to change the lives of a woman. Because as a pelvic
Yeah.
health physiotherapist, you are not going to change their muscle. You are going to change their lives forever. They are going to remember you
Hmm.
for their lifetime. And that's a great
Right.
part.
राइट तो डॉक्टर दीक्षा हम डिस्कस कर रहे थे कि ऑन एवरेज आप फुल डे ओपीडी में रहते हैं सो व्हाट डू यू थिंक कि जो कॉमन मिथ्स होते हैं assumptions होते हैं पेशेंट्स के या इवन डॉक्टर्स के जो रेफर करते हैं other health professionals who are referring the cases to you what is this general assumption that is seen but according to you it's just an assumption मतलब ये फैक्ट है ही नहीं बट लोग पहले से
Actually,
इग्नोर करते
Mansi
आ रहे हैं
dear,
सो वो
I
चलती
just
जा रही है
Mhm. Actually, I just want to confess one thing. In this hormonal wings, we never have a referred patient. Whatever the patient
वाओ
we got through ourselves only. We never got a
Okay.
referred patient. We got somewhere, but now it's like that. वहां पे जाओ वही होता है. It was like that line. वहां पे जाओ वही होता
Okay.
है, and it is great. It is great
Yeah,
because no
that's
one is
very
referring me,
interesting.
because no one is referring me to like put SW to the patient, do the
Right.
UST because you are a physio, you could just go for it. Because in you know, the best part about the hormonal wings, we are not only running the pelvic health physiotherapy OPD, we are running the 3 OPDs there. One's for the OBS
Yeah.
gynae, for antenatal, postnatal. Second is the normal OPD I'm having. In the 3 part, we are running the OPD. In the third section, we are having the pelvic health. The more, because these patients, the pelvic health patient, because you are dealing with the intimate muscle, more intimate and
Yeah.
more confidential muscle, and
Hmm.
you are like touching the soul of a patient actually.
Yeah.
So that means you need time, patience, and courage to actually look on her eye, look on her attendee eye, to say
Hmm.
yes, you are confident enough to deal with it, because you are not,
Right.
because I'm not married yet, but still I have dealt with more than 200 to 300 cases yet with a positive response, and they trusted me.
Hmm.
And that's the best part. That's the trust you begin with your patient, because I never get the referred patient, but still this name, like I think it is now international brand, and
Yeah.
we build it. Yeah.
या सो टेल मी डॉक्टर दीक्षा आप बोल रहे हैं कि करंटली आपके पास रेफर्ड पेशेंट्स नहीं आते हैं सो हाउ डू यू हैव पेशेंट्स कमिंग इन अगर रेफर्ड नहीं है तो लाइक हाउ इज दैट प्रोसेस गोइंग ऑन
Actually, in the very starting, I started with the normal OPD only, because no one knows here. In my city, I'm living in a Kanpur. I started in a Kanpur. Before that, I'm living in a Delhi, and now I've come back to Kanpur, my hometown, because I'm missing my mom dad like hell. I come here, and here I started my OPD, because once I got to the hospital, and the undisciplined that and the treatment toward the physiotherapist, I was just got so hurt, because I just studied so much and I'm not going to listen to this much of stuff. So that's
राइट
why when I started it now, at that time I'm working on my first book. At that time
या
I'm too busy, and even I'm studying at that time. So during that time I started with 2 patients only, and they are both women's. And
राइट
I don't know, I just started with the normal OPD of first case is I think diabetic foot is there, and second is
या
I think polyneuropathy case is there. And why I
ओके
taken those 2 patients, because these they are like they are too old, and no one is going to come to their places, and they just find me out, I don't know how, and they are like Punjabis, and they just come to me, and they are like I think for 20 slots they are like all fit. And after that our hormonal wings run off, because the one patient is dealing with the incontinence part, and during my consultation I just found it out, because she come me for the orthopedic part, but I just took her to the, I just push her to
राइट
that, come to the pelvic floor part. And the second patient, now again I got the yeah, that her hysterectomy is there, so I just now again push her to that part. So this is how, because we are new to field, we are new to
या
something, that means we have to introduce it to our patient, because the patient is innocent person, he or she didn't know it, so we have to introduce it, but in a good manner. Because
या
I have given my consent before my research to my patient, and they also give me to the consent to please carry on with your research. So this is the best part.
या
We have trust on each other, and now we are having more than 5,000 patients. We deal with it in this clinic.
Yeah, that is amazing. So I think for everybody who is currently interested in pelvic physical therapy could understand that, I think it's not just about this particular sector in our field. कोई भी sector में अगर हम अपना startup कर रहे हैं, initially हमें, I think, discussing this forefront कि we have to educate our patients and create awareness is going to be the prime
नहीं,
key. Yeah, to start.
एक्चुअली मेरा एक सजेशन भी होगा to all juniors. Like first thing, build your own skill. Second, educate yourself as much as you can. And third thing, trust yourself. Try to trust yourself first. And after these 3 things, you actually, whenever like, for example, MBBS or surgeon, whatever those are, they started their work. No one is referring them patient. Then why are you like sitting like hell and waiting to someone to like they will refer, then I will treat. Okay, they will give the
Right,
prescription, because the best part in hormonal ring, we have our own prescription, we make our own diagnosis, and we write it
right.
down, and we dare to write it down because we know we are right.
Right. I think that needs to be discussed as well, that we are
Yeah.
capable of making our independent diagnosis,
Yes,
but
because
that's
we
for some
are we
other
are
day.
we are studying so much that mean we are licensed for it. We are
Yeah,
not
right.
licensed for medicine, but we are licensed for the prescription of exercise because we are the exercise specialist.
Right, exactly. So I think understanding for all of us from Dr. Deeksha that being confident in our skills and then using that to diagnose and treat should be enough. We use our own
Yeah.
skills and then make the diagnosis so that if we are questioned, we can always have an answer. So डॉक्टर दीक्षा जब आप skills की बात करते हैं so let's discuss और थोड़ा सा कि as a fourth year मुझे भी interest था कि it's an evolving field why not go into it and understand कितना scope है तो उसमें ऐसा लगा कि किस चीज के पर्टिकुलर स्किल सेट होने चाहिए आपको क्या लगता है एज somebody who's practicing what particular skill
Uh,
sets must a person
you
have
are
or
asking
should
for
they
pelvic
develop
health or for physiotherapy?
no no for pelvic health particularly
Okay.
if I am
Well,
interested
before,
for it.
yeah, okay, okay. If you are interested, then well, please welcome. You are always welcome.
Yeah.
First thing, because we need a community in India too. That's why you are welcome there. First thing, before starting going for pelvic health physiotherapy, just consider yourself to establish physiotherapist first, physical
Right.
therapist first, because most of us, why physiotherapy fails many times, why patient like discourage, and because from last 7 years we are having the patient's family, because if someone is ill they will come to first to me, they will meet me, then they will go anywhere. This is now I am referring the patient. This is the best part.
Right.
You will have to build their trust to your patient. For this, the basic physiotherapy. Just practice the physiotherapy. If you are like in a bachelor for 3 to 4 years, started practicing physiotherapy either in hospital, in
Hmm.
whatever clinic, or if you are going for visit, then go with in a confident way, because you are not
Hmm.
someone like their servant who is coming and they say physiotherapist aaya tha. No, this is not
Hmm.
the language they can deal you with, because I hate it because someone when talk in this way, no, because in the starting I listened to this ki, like physiotherapy, we physiotherapists are not legally call it as a doctor. Yeah, that's why I studied so much to become a doctor. I started from my research work. Okay, ठीक है, फिर doctor तो रहेगा, like you can't took it from my name, because I know I'm dealing with that much pressure. But as a physio, whenever you started doing na, just start respecting your field first.
Hmm.
When someone asks you na, like just like in my example, in my intern days, some nurses from that department, they just used to ask me, doctors used to ask me na, in a row ki, like questions, and I used to give answer. So one nurse asked me one day, you are so much like interested in study, you are so good at study, you always answer than MBBS student, and why didn't you go for the MBBS, why you choose physiotherapy? And they also know, because I'm the like
That's a
topper
very
of my
controversial
during 12th.
question.
During the 12th, I'm like having very good with the maths and bio. They just asked me this. So I was like, I stand for 1 minute, and I said, because since childhood I want to be a physiotherapist, because I'm
Yeah,
so
that's an
interested in this field.
amazing answer. Yeah, not everybody chooses our field as a second option. Please believe that.
Even
Right.
after my that in from my school, also from KVs, they just number of student after seeing me, they just joined me. My cousins joined the physiotherapy,
Mhm.
because physiotherapy, according to them, if you saw with their eyes, it is like they are seeing me, they said, "Nee, it is a successful field, we are going for it."
Right. Right.
Because someone is
Right.
seeing you as a physio, so be a good physio, be a good example to them actually.
Right. And other
So
skill sets like something else, जैसे once I used to you suggesting कि थोड़ा सा do practice and develop some confidence and respect for yourself. So what ahead?
yeah,
I did that. Then what else should I do?
now start reading your books
Hmm.
first. Before going to surgery, please start reading normal anatomy. Before going to, because once you capture the anatomy, na dear, once you capture anatomy in your head, once you capture physiology, no one can beat you. I guarantee,
Right.
I can bet you, no one is going to beat you, because why like surgeons and anyone in our city, they are like, they respect my skill, because even they are my patient too.
Hmm.
You know why? Because they can't beat me when it comes to anatomy. I can do it. I can do it. I can challenge anyone to do it. Just come and do it because I know my field better than you. I'm a good
Yeah.
physiotherapist in my eyes. So yes, if I'm wrong, I will learn from you, and if I'm right, I'll show you ki, yes, I am right.
Yeah.
So this is the thing you need. You need to read. You need to read.
Okay.
You don't need to learn. You don't need to uh, remember and everything, but you have to read at least once.
Hmm.
Yeah.
Okay, so like I feel like understanding, keeping our, basics very strong and having respect and confidence would really help us,
Hmm.
elect and feel confident enough to opt for pelvic health. So, Dr. Diksha, you are working independently right now in a setup where you are catering to a particular set of patients. You're catering and you're providing, pelvic physical therapy. So, what do you think that there is this particular skill set that is needed to be successful in this particular part? Like, to
Uh,
create an independent setup and work होता है ना अच्छे से काम चले, like we are not stagnant in our growth वैसे.
okay. For pelvic health physiotherapy, you first need to, as I already told you, read, and now
Yeah.
started writing things. As an always try to write up because you are
Yeah,
a
that's
doctor.
very
You are like
interesting.
you are coming new to field. Started writing because whatever comes to you, okay, you are not a Shakespeare. It's okay. It's okay. It's done. But at least write something. Write something on
Yeah.
daily basis. When the patient comes to you, na, at least write. If you don't get anything, na, just write about what he or she told you about
Yeah.
her history. Because you are not getting it. You are once you are na, get into habit of writing now, you will love to write. You will going to enjoy it. You are going to enjoy your field because before going for anything, na, just try to have passion for it because once
Right.
you have passion, no one can beat you at your field. And second skill, as already just if you read like anatomy, once you saw the patient, you should have that observational skill to have that skill that the patient is coming to you. You can just scan the basic
Right.
problems. Once they enter ना, you should know कि okay किस लिए आया होगा किस लिए आए होगे ऐसा you should know.
Right.
You should try guessing whenever you are on a road, you are sitting alone in an Ola or car you are driving. Just try to look on a road. Try to guess the whatever that okay deformity है okay arthritis है okay ये grade हो सकता है. तो
Low key we are
this
judging people, पर ठीक है.
नहीं आप जज नहीं कर रहे. You are like actually you are reading the person. Judgment is a wrong word because judging is something
Yeah.
like you declared कि यार तुमने ऐसा
Yeah.
किया है. But
Right. Right.
once you are like you are because since my medical days, since my days, I was like this only. Whenever I'm like driving, I'm seeing person, I like okay ये great होगा, definite होगा. I can bet इनमें से पूछूंगी इसे क्या. So even now as a pelvic health therapist, जब भी कोई person like whenever he or she is walking ना, through her posture only I can most of time I'm right. I am not saying कि
Yeah, we
always,
used to
but
do
most of
that.
time.
Yeah,
Yeah.
second
So
year में
I
तो
can
पहली बार second year में
yeah I
हमें
can
तो
just go
पहली
for
बार
pelvic.
gate. Yeah, when we
Yeah.
taught gate for the first time in second year, we used to do that. Sit in front of our college and judge. जितने भी बच्चे जा रहे हैं, yeah, tell us. But it actually works, It gives us a good perspective because we
Yeah.
need experience to learn. We
Yeah,
need experience to
gate
do
is
things.
indeed important. Whatever sort of physiotherapist you are, you need a gate knowledge. You should
Yeah,
have
yeah,
because
right.
yeah, Mansi, one more thing. There's a one myth about the your obs gynec or pelvic health physiotherapy. Ki you are a like pelvic health therapist na or obs gynec. That means you have to deal with this muscle only.
Right.
Rest of body is hell. You don't have to go for it. No, this is wrong. Once you are the pelvic health physiotherapist, that means from head to toe, you have to study now muscle because you don't know
Hmm.
which muscle is now. Sometimes the TMJ joint is there. It is
Yeah.
like triggers are there, and you have problem here of leaking because of this joint. You are
Okay.
like this posture, so you are leaking.
Right.
So because neurological disorders are there, so as a pelvic health obstetric, now you are stuck. You have to study every field because you have to go
Hmm.
for cardio. You are dealing with inner core. You have to go for orthopedic because you're dealing with the bones too. Sometimes you are dealing with the neuro part. You are dealing with the musculoskeletal. So you are now all rounder when you come to pelvic health.
Right.
Yeah.
Yeah, because that indeed जो आप बोल रहे हैं that's very correct. There's this prejudice कि pelvic health से अगर आप associated हैं तो आप सिर्फ pelvic floor treat करने वाले हैं. But it is good because I feel like understanding that everything is related would give us better results also. So,
Yeah.
जब हम last time we were on call, Dr. Deeksha, you were telling me that you opted for your masters because that's what interested you for in research, which is very interesting to me. Because for us, एक general assumption क्या होता है कि आप मतलब थर्ड फोर्थ ईयर करो, कौन सा सब्जेक्ट अच्छा लगता है, इंटर्नशिप में you'll definitely find your niche and you pursue that area. That's how, that's a general assumption. So when I heard you talking about कि I opted for OBG because मुझे उसमें research करनी थी, which is very interesting. Let's like explain, like talk to us about that more. We need that sort of enlightenment.
Because whenever I was in second year, na, I used to read papers at that time in my
Right.
bachelor's second year. So at that
Wow.
time, I used to get number of patients of ortho, number of patients of neuro, but I never get a
Yeah.
paper of obs gynae or pelvic. At that
Hmm.
time, in year 2011, I know that word, pelvic
Hmm.
health obstetric. Even my
Right.
classmates, my batchmates, they don't know about this word. Okay, this exists also. They used to say,
Hmm.
because Kolbeck is a book which got a 2 to 3 page of chapter of that
Hmm.
reproductive health of a woman's,
Right.
and no one is taught you this, because my my professor came to the class and she just said, okay, this is not important, this is not coming to exam, so move on to next chapter. And I was like,
Yeah.
what? I was waiting from 2 weeks to come to this topic, and now you are saying ki, like, move on, because nobody, because it's
Yeah.
not none of your use. So because they are
Yeah.
saying, what is your perspective? You are as an antenatal postnatal, you can just go for biceps strengthening, you can go for hamstring, you can go for calf, because what else you can do? So I was like, I was very hurt at that day, because I was like,
Yeah.
I was waiting for that day since like a generation, and then she's like telling me I am having no role. And then I asked her, ma'am, because she's I think passed out from my professors from Nirtar only, I think. She's
Yeah.
a very intelligent person, and she's
Yeah.
telling me कि like नहीं कुछ नहीं हो सकता. तो अभी like अरे ये अभी करना क्या है, मेरे को तो इसी में जाना है. So
Hmm.
she's like कि नहीं, there's no field because you got good marks, go for ortho, you will make money, go for
Yeah.
neuro, you are having a good
Yeah.
mind. She just suggested me this. So I was like, no, I will search for it, I will search the day, if I don't get it, I'll make my own way, but I'm not going to
Yeah.
change my things.
Yeah.
Or at that time, I
Yeah.
don't know even the OBS clinic exists or not, I don't know.
Yeah, but that is very inspiring because वो हिम्मत जो जुटानी पड़ती है to understand that it's okay if not everybody is doing the field, we can still do something, if we want to. So I feel like preaching that please follow your interests is very important because look where it got you. Hopefully we can also get somewhere near, you know?
You can go, you are going to be more better place, because you are sitting in front of me now. You're talking to me. You are just, I think 6 to 7 months you're pass out, na, dear? You are doing your job. At that time, even
Too
no one
much.
given me, even I have not get, I have, till the day, I didn't get any job from any side. So you are much more better than me now from your CV.
No, but thank you so much. Okay, so there was one thing that we were interested in. We have a lot of people that come up with questions. Ki, okay, we did masters in OBG.
Yeah.
Now tell us what more can we do, or kya kar sakte hain. So, like, what do you think there is more in the country, outside, in general in our field to explore?
Okay. In India, if you want to practice in India, you can go for a number of courses. At first, if you did in MPT in Ops Training, it doesn't mean you are just stuck to it. If you're not
Right.
feeling good about it, because the bad thing about this part of Ops Gynec and pelvic health, you are not making much money,
Mm-hmm.
because it's same like once the physiotherapy in 20 years back, when the physiotherapy introduced to India in an
Yeah.
exact format, we are not making much money, but yes, we are creating the awareness. Some physios created
Right.
the awareness, that's why we are sitting here now. At
Right.
that phase, we are here. From last 7 years, I'm creating the awareness for that pelvic health ops gynec. I'm creating the content so that the student should know कि actually this field
Yeah.
exists. ऐसा कुछ होता है, like ऐसा हवा में नहीं है, it
Hmm.
is there only in this world only. So if you are in India, if you are if you want to make money, then you can have money from like your physiotherapy field, and you can
Yeah.
just go for reading of the papers. And if you want to like go to outside, just if you want to go to US, like Canada, you have to go through some process. Exams are there, you can just go through
Yeah.
this, like language exams are there. And after that, in we have pelvic health MPT, physiotherapy in Loma Linda University in Canada.
Yeah.
So it's you can
Okay.
go there. So there are number
Right.
of like in Caro, is it too, we are having pelvic health courses in the, I think in London too we are now running pelvic health courses, but not in
Right.
India, because in India now we got the obs-gynae. But you know what we lack in India? No obs-gynae. When I did, no professor was there. No one is my guide at that time for my research.
Okay.
My
Okay. Okay.
when I don't have any guide. My elder sister, she's a CSI research fellow. She helped me how to
Yeah.
do it because I did
Yeah.
my whole research on my own, because I have to just
Right.
collect everything on my own, because no one is there to help me, because they don't know actually.
Right. Okay. Yeah,
Yeah,
that's difficult. That sounds very difficult doing a research without
yeah.
guidance. Yeah.
So
Okay, so
only I
Dr.
have
Deep.
my guide, but she's from cardio part actually. So
Oh, okay.
she like she used to tell me अपने आप कर लो. I don't know कि ये तुम्हारा टॉपिक ही क्या है, मेरे को समझ नहीं आता, because my topic is sexual health. On vagina I was studying.
Right. Okay.
Yeah.
So that's interesting. So you were saying that अभी भी once अगर इंडिया में नहीं तो बाहर there are currently more growth options, right? We can do. So is there
Yeah.
like any other short-term courses that you think would help with boosting career in this field particularly?
Okay. If you are seeking for courses, my one line suggestion to you is don't waste your money, because you earn it.
Right. Yeah.
Because
I know
whenever
this.
you're
I
going for,
know this.
because you earn the money with so much of passion, with so much of dedication. बोलते हैं ना, खून पसीने की
Yeah.
कमाई है आपकी यार. You can don't waste it in
हाँ.
such things. हाँ, if you want to learn na, many things, just ask me. I'll just send you the many links. You can just purchase the books actually. You know, I'm writing
Yeah.
the book so that actually people can get help.
Yeah.
I'm running like channels because so that you can. We Hormonal Wings running our own YouTube channel so that actually student can get help. You don't have to waste your
Right.
money, because whenever you're going for any courses, not for ops gynae, whenever you're going for any courses in India, actually in India, so please check for the credential if they are going to give you any CME or not, because
Yeah.
they are taking from you 30,000, 10,000. If they are going to give you any CME or not, if they are not,
Yeah.
please don't join it, because it's
Yeah.
not none of your use for your CV, because when you're going to write it in your CV, na, no one is going to give you a job on that basis.
Yeah, yeah. This is something that we were told about even when we were leaving college. They were like, this is a huge market. हर course करने की जरूरत नहीं है आपको. Do not fall into
Yeah.
that trap. But that's great, to hear. So, Dr. Deeksha, there were certain questions asked. So let's discuss those
Okay.
questions. Let me see just a minute. Uh,
It was great, no? On short notice, people are there. Even I don't know. They just leave.
no, so somebody mentioned that,
Yeah.
yeah, in India there isn't much women's health physiotherapists as compared to foreign countries. So I think that would be just because courses उतने available नहीं है, awareness नहीं है उसकी. So
Yeah.
इसीलिए हम conduct भी कर रहे हैं हमारे sessions ताकि we
Yeah.
boost people कि there is nothing to be afraid of in the field. There is guidance available, there is data available, there is work available. There's
Yeah.
Dr.
You
Deeksha
just have to read.
available. Yeah.
Yes, I'm out I'm living. I'm living for the women's. So
Yeah.
you can.
Okay, so there is somebody who is asking that how did you grow your clients when you first started the OPD? Like after what time were you known to the public? Like आपकी general image कैसे create हो गई? हमें क्या करना चाहिए कि हमारा थोड़ा clinic का growth हो? Because currently there is a
Okay.
lot of clinics that are open, right? That's why.
Okay. So before starting, I would like to connect with some moments in year 2000. I just cleared my SSB too. I am a
Yeah.
serious cleared part two. I defense officer exam. At that time, I become too dedicated, too disciplined, and that helped me in my
Yeah.
field actually, because I was too
Right.
punctual to my time. If I given you the 7 na to my patient, if they are 7:05, I just मैं उनको वापस कर देती हूँ. Because you don't respect my time, I'm not going to respect your like whatever the short of your suffering. I'm not going to take the OPD at that day, because money is the
Right.
last thing which matters to me. Because if
Hmm.
you're coming now, because if I'm here, you have to come by time. So first thing is time management. Because first thing
Right.
you have to respect your time, and second thing which
Hmm.
I what I sought in my notice in OPD, the charges like whatever like you are taking, it should be fixed, and it should be lenient on basis of like on line of like if the patient is below poverty line, if she's a woman who is divorced, you don't get any money from her husband. In these two cases only I am flexible. Otherwise, I'm the person who is going to say, okay, I'm going to get the free OPD to you, but I'm not going to let my charges down because of this thing you are saying me, because I'm not selling here vegetables. This is not a
Yeah.
fish market.
Correct.
This is a respectable way, and you have to behave in that. Because I'm behaving in that way, you have to behave in that way. Second is your
Yeah.
money management, time management, money management, and because in our practice, what I see, जैसे लाइक पेशेंट आता है तो इन दिल्ली व्हाट आई सी, जैसे
Hmm.
एक की रो में 3 क्लिनिक्स हैं. अभी आपके पास पेशेंट, यू गॉट द पेशेंट, नाउ व्हाट यू सी, पेशेंट आया, पेशेंट ने बोला लाइक नहीं मैं 300 नहीं दे सकता. नाउ यू सी, अरे 250 दे दो. नहीं नहीं मैं तो 2 मैं तो 100 से ज्यादा दे ही सकता. यू नो द डील गोज अप टू 50, यू नो वे आर यू टेकिंग टू योर फील्ड.
Yeah.
Because you want the patient, it's okay, don't go for any patient. Go for visit
Right.
if you want to make so much of money, but please don't let the profession down in your clinic.
Yeah. Yeah.
So this is a respect your profession. And third,
Yeah.
fourth, most important thing, whenever the patient comes to you, as a physio, what we like, we never diagnose anything. We never ever diagnose anything.
Hmm.
Patient comes to us with the prescription in normal clinics. I am telling, they come with the
Yeah.
prescription. Even most of physios, they don't ask for any kind of reports, MRIs. They don't ask for like your sonography. They don't ask for reports. They are like, okay, you come, you have pain there. Oh, okay, I'm just placing the tens over there. Okay, now it's the intensity is okay. It's not hurting you. This is the time. This is like way I have listened, na? And my like
Yeah.
I was, what are you doing to your profession? Don't do this. Please don't do this. My heart is crying out. Please don't do this. Because
Right.
if he or she is coming to you, just start your OPD with the first, with the like proper IPR. Start
Yeah.
your OPD with the consultation first. Try to
Okay.
listen to him. Try to go with the SOAP method, that is subjective, objective assessment process. You
Hmm.
have to observe. You have to actually prove to show to that person you know more than him or her, because
Right.
they already googled this. Because the patient, whenever the patient comes to me now, my first line is, I'm not a magician. First thing, I'll take my time. But yes, I'm promising you, if this is treatable, I'm going to treat it to 100%. And if it is
Right.
98%, I'm going to treat it 98% only. Second,
Right.
please respect my time. Then I will respect your disease. If you don't respect my time, I'll kick you out of my clinic.
Yeah. That's great. I feel like
Because
having that professional presentation is required because we often let others' mentality towards our field let us affect our behavior. So I feel like,
yeah,
yeah, having that
you
strong
know,
set of mind is important.
after after my persuasion, I have that. After the abroad, when you comes to like this, like in Kanpur, it's a metro city too. It's a great city. Even number of richer people are living here. They have lots of
Yeah.
money. But the
Yeah.
mindset. The mindset is it's because of our physiotherapist only, because they are going to their houses. They are not. They are going in a lower only, and they are going for the visit. Why are going in a lower?
Hmm.
Just don't you have clothes? Wear some clothes. Wear some good
Hmm.
clothes. Have some or have some positivity. Have some charm
Yeah.
in your way. Because
Right.
whenever the person is looking at he or she is looking at your profession. He or she is looking at your qualification. He or she is not looking at you. You
Yeah.
don't actually need a proper makeup. You need simple outfit, clean outfit, and
Yeah.
more convenient way of talking, because you don't
Hmm.
have to be too friendly, too loud, too
Yeah.
harshy, or too nostalgic, because आपको सब कुछ balance करना है. Because you don't have
Hmm.
to be yourself there. You are a physiotherapist there. Be the physiotherapist only. वो
Right.
whenever the auntie or like coming with a child na, oh baby, don't do this, please, don't do this, because the
Yeah.
baby is not yours. You will have your baby
Yeah.
once in a while. If you're not, someone in the family is going to have it, so leave the baby. You are a
Yeah.
physiotherapist there, because what I saw in whatever I saw, I'm just telling you. In the US too, I just saw it. Whatever I saw, I'm just telling you that only. So I just hate it whenever
Yeah.
someone in the scrub say it na, oh baby, like I will hold your baby once you get the treatment. Why you are holding? Are you Aya?
Yeah.
Who are
Yeah.
you? You don't have any work. You don't respect your time. Because
Yeah.
in my OPD, at least in hormonal wings, if you're coming with your baby, either come with the attendee who will just have the baby, because we are not having any like daycare center for a baby. Secondary,
Yeah.
it's not my baby, it's your baby, just it's your responsibility.
I love that. I love that.
Because
That's great.
because someone just asked me in my clinical practice, my patient, dear, you are dealing with the pregnancy part, still you are not interested in kids. Yes, once in a while I am going to interested in kids, अगर वो मेरा होगा तो. Otherwise, in my
Right.
clinic, I'll forget my kid too. Otherwise, in my
Right.
clinic, my kid is also not important. What important here, it is
Right.
physiotherapy. So, because if I'm a pedia, yeah, definitely I'm going to get involved with the kid. Because
Yeah.
you should see me treating a pregnant women. Whenever I'm dealing with a pregnant woman, I'm like happiest. I'm like
Yeah.
dealing them like a person, because like a gem. Because this is the
Yeah.
thing I'm waiting for a day. Ki like you'll
Yeah.
come and I am like healing you. I'm sharing you that way, that vibe, because that through that vibe only your baby is going to come out to this world, and I just want that vibe to be very positive. I just want
Right.
that baby, because the patients come to like our OPD, they come their kids too. They just want to show she is a doctor and you have to be like this, like her, because she's cleared this, she cleared this, because they are like so much of like have respect
Right.
for me, respect for our
Right.
clinic, respect for our like whatever the like persons who are working here, they have respect for it, because the person who is like cleaning my OPD too, they have to wish him also, because in our clinic
Right.
there's one system. You can't say me good morning, you can't say me good evening, you can't say me good night, you have to say me Jai Hind, because this is a one time tagline of being an Indian. Because patient come
Right.
Radhe Radhe, patient come Jai Shri Ram, patient come Namaste, patient come good evening, good morning. I am confused what I have to say, so I just
Yeah.
hell off, I just Jai Hind. This is
Hmm.
even on noteboard too. He just call the doctor Jai Hind, otherwise say nothing.
Right. That is fun. I feel like अच्छा है. Good. You're teaching also some people कि भाई at least हमारे area में please अपना वो थोड़ा दूर रख लो. But it's
नहीं,
okay. I
actually,
feel like
clinic is
it
having a
was
very
great for
positive
you to
aura.
answer that. Yeah, because for you to answer that question, that was a very serious question. आपने उसे बहुत positive way में present किया, but that's a very serious question. A lot of people, have that कि हम कैसे grow करें. So I hope you answered all of their answers. So yeah, I think no more questions. Yeah,
Yeah, one more thing, actually, I just want to tell you dear. If you
yeah,
want to be a pelvic health therapist, start doing it with your home. Charity begins at home. Start
yeah,
counseling your women first, because once you counsel your mother now, once you counsel your father, because the day I come back to like my place, my father come to airport and we are like on a in a car, and he just asked me, okay, now what this time Diksha, what you learn? So I was like, I learned about the vagina dead. So he was like,
hmm,
what? Okay, I learned about the vagina, the sexual health part, because there's a missing link. Even our driver is there, and I was like
hmm,
talking so freely because I learned it.
yeah,
And you are asking
yeah,
me, and I have to tell you what I learned, because
yeah,
the things begin
yeah,
at home. Once you talk it in front of your father, your father-in-law, your mother-in-law, that means you are confident enough. No one can beat you now.
right, right.
So
So I think we've answered all questions asked. And yeah, I think it was great having this chat. Fun it was.
Yeah, actually, I'm feeling good. My like मुझको नींद आ रहा था when the OPD is open. Now I'm feeling more energetic, more positive aura is there.
That's great. I hope all our audience also feel energetic. They pursue pelvic physical therapy without any questions, without any doubts. If you have doubts, there is data. Please refer to it. We have people like Dr. Deeksha who have their presentation on Instagram. Please refer to them. Please come to Physiozest. We are representing a lot of fields that have not been spoken about. So I think yeah, that is great.
Yeah, actually, it was great.
Yeah. Now you can also go home. It's probably the end of the day. It's almost an hour we had the
Yeah.
chat for.
Yeah, actually, I just have to work. No, one more thing, dear. Okay, okay. I'll just forget. Otherwise, okay. This is my first book. It's all about pregnancy, and this is my second book.
Yeah,
It's all about periods.
yeah,
So these are my two books. If you want to know anything about the pregnancy, from the day of she conceived to the childbirth, labor part, as a physio, even this book, the best part, this book is not only for physios. This book is for MBBS, obs gynae, because this book is all about pregnancy. It carry data for everyone, and it carry data for postpartum depression, and your QA sessions are also there. Then second book, it's all
right.
about periods. This book is more important because this book is completed in, I think, in during my when my dad is admitted in a hospital. This book is I completed in a hospital only when he was there, and I just completed this work there only. And this book, why I completed this book, because most of patient coming to me at that time of menstrual health disorder like PCOS. I think everyone is familiar with this word, missing cycle. Because nowadays if you ask your friend to na कि अरे यार cycle आया ही नहीं है, like आया है तो
Huh.
2 days 3 days, because this is because of stress our lifestyle.
Yeah,
So this book contain on the second book. This book contain the data on your that periods part, and your treatment is also there. I wrote the
yeah,
treatment in this book is for every girl who
yeah,
menstruate or who not. Because if you
yeah,
don't, you get it. If you,
yeah,
then you also get it.
yeah.
And
That's great.
the best part, the book cost only rupees 99, because this is my gift to every woman.
Hmm. That's
So
amazing.
yeah. So these are the two books. If you want to know more, please don't go for any kind of workshop, because 99 rupees तो मैं ऐसे ही खर्च कर दूँ, 500 रुपए.
Yeah,
So you can go for reading, as I already
yeah,
told, go for reading. हाँ, but
yeah,
for hand-on practice you can go for anywhere. But please
yeah,
always अपने resource person के बारे में पता कर लो. Like if वो भी practice करते हैं OPD में कि नहीं, because he or she is not practicing, then what he or she is going to talk you,
yeah,
because you need a person who is good at hand-on practice.
yeah.
Okay, yeah.
Right. Okay.
So now you can sleep.
Yeah. Yeah, so for anybody who has extra questions, they can send it at TPZ. You can DM us, and questions that you may have relating directly to Dr. Deeksha's books. So you can DM her for that. And I think that's it for today.
Yeah, that's it. And even I'm shifting to
Okay.
Mumbai, dear. Nancy will meet you there.
Yeah, we have to hang out. That's going to be fun.
Yeah. Okay. Let's meet then in real.
Okay. Yeah.
Okay.
Yeah.
Okay. Bye, dear.
Great.
Good night,
Bye-bye.
everyone.
Bye.
Whoever is here at a very
Yeah,
short
good night to
notice,
everybody.
because I didn't expected this.
Yeah.
Yeah. Okay. Bye, dear.
Okay.
Good night.
Bye-bye.
Bye.
No, are you sure you want to enter a live? It's not asking me. Alvira.